Hello everyone, sorry for the poor quality, I'm recording this on an iPhone because it's all I have. But before I start with the video, I'm gonna just give a little disclaimer for legal reasons. I am in no way responsible for any of you for anything in this video. This is purely for academic purposes. And with that, let's just jump in. So, hello, I'm Anco Canadian, part of the Socialist Hype House, and since I have over about 100 hours of first responder like medical training, I thought I'd make this video for anyone interested in becoming a street medic during these protests. I'd like to add that this in no way substitutes actual medical training, but if you already have some type of medical training and you're going to these protests and you want to do more, then this video will definitely help you. I can't really teach you everything I know, and I can't really have you practice because, well, it's over the screen. But for those here for the actual medical training, I'm going to start off with medical legal, supplies you'll need, planning, the patient assessment, patient evacuation, body systems, life-saving first aid, street first aid, which encompasses pretty much the bulk of what I'll be teaching: head injuries, major bleeding, minor bleeding, fractures, dislocations, spinal injuries. I can't really separate it into other categories. Then I'm going to talk about other medical issues other than injuries, psychological care, cataloging injuries, debriefing, and then just an overview of everything else I missed at the end. After that, it'll be followed by what I just mentioned before, the DIY riot gear, riot tactics, things like that. And then at the end, I'll mention other resources to just further your knowledge on this topic, if you want. Just a little disclaimer, sorry in advance, but basically all the first steps from medical legal all the way to just life-saving first aid, it's going to be mostly just explanatory, mostly just planning, organization. It's going to be a bit dry, it's going to be a bit slow, but hang in there because it is important information. But as soon as we get into advanced street medic training, it'll pick up. So apparently this lighting makes it look like I have anyways. So I'll start off with medical legal, everyone's favorite. Basically how not to get sued. You have to know your local laws, your local rights, what you're allowed to do as a civilian, what you're allowed to do during these protests, and what you're allowed to do even if you're certified as a first responder. So an example would be, I'm Canadian, we have something called the Good Samaritan Act, which basically protects people from helping those that are in a life-threatening situation. So let's say if someone is unconscious on the street, we can go help them and not get sued for it, basically, or get legal punishment for it. That being said, the Good Samaritan Act has limitations. For example, once we start care, we can't just walk away. We have to give the patient to the next level of care provider, most likely a paramedic. We also can't do things that we're not certified or allowed to do. So if you took a lifeguard course, then you know CPR, you're certified to do CPR. You were taught these things and you were given a certificate as proof that you were taught these things. You can't perform something like a tracheotomy with a lifeguard certificate. This video unfortunately does not cover you, it does not give you a certificate, but all this is to say that it's important to know your local laws as they change province to province, city to city, state to state. Okay, the next thing we're going to cover, supplies. Where are my supplies? Okay, so for supplies it's going to be a bit longer because I'll be explaining what they are as they go. But you're going to need to, well, this is not going to be in any particular order, but you're going to need protective equipment. That means gloves, and a lot of them. You're going to want to switch out gloves with every patient because you don't want to you don't want to infect one patient's wounds with the blood from another patient. That's just horrible. So get a lot of gloves. Get masks. Same concept applies. If the person injured doesn't have a mask, give them a mask. I really suggest getting your own mask and getting I'll just open this up here. Carbon charcoal filter. These filters filter out the tear gas very well. You can get a filter like this. Any store you can buy a mask that has a filter like this. You're gonna want a face shield. I'll teach you how to make a face shield later, just how I'll teach you how to make a mask later. But you can also buy a face shield. This one I got for $12 at a hardware store. Masks also you can get pretty much anywhere. Same with gloves, especially now. And remember, we are still in a pandemic, so protecting yourself and protecting other people is very important. Next, we're going to talk about things specific to this protest. like pre-made solutions of water and baking soda, which I will teach you how to make later. Get a few water bottles, collect empty water bottles. In the past few days, I have several hundred empty water bottles. And prepare. You're gonna need baking soda, water. Really simple. You're also gonna need bandages and gauze. Here I separated. We have gauze rolls. This very important to get. Not very important, but it's much easier if you have this. It's self-adhesive sports tape. You can get this at pharmacies. You can get this at the dollar store. These rolls were from the dollar store. And basically what they do is you wrap it around the injury with gauze. And it basically sticks to itself. You don't need to add a clip or pin. You don't need to tie it. It's really easy and it holds really well. Gauze, obviously gauze. Gauze pads, especially important. You don't want to start cutting up gauze in the middle of a street. Also, gauze pads you can also get at the dollar store. You're also going to want another section for wound disinfectant. I highly suggest getting this solution of povidone iodine. They sell it in 10% volumes, and what you're going to want to do is dilute the hell out of it till it's this consistency. I put it in the bag because this squeeze bottle is also from the dollar store. But till it's a consistency of about iced tea. This solution will kill all the bacteria, but unlike alcohol, it will not damage the healthy tissue. Get a spray bottle. This is a squeeze bottle, also from the dollar store. But you can also get a syringe and make it on the spot in a water bottle. Just add a few drops of this, and it makes a powerful disinfectant. The reason we have squeeze and the syringes is to actually pressurize into the wound to clean it up well. You're also going to want drugs. Very important if someone's in a lot of pain. Get your over-the-counter painkillers. So there's Tylenol, Advil, aspirin. I'll be explaining the difference and different circumstances in which we use them later. Oh, also for protective equipment, earplugs. A lot of police stations, I heard, are about to implement sound cannons. Get gel earplugs, don't get the foam ones. The gel ones fit to your ear. They will not fall out when you're running. They won't be that uncomfortable since they're basically they'll be customized to your ear shape. And they will diminish the impact of the sound cannons that they'll use against you. Also for protective equipment, ones. This is basically a mat you put on your chest for rubber bullets. Unfortunately, we need protection from our own police officers now, so that's fun. But yes, I'll also be teaching you how to make this later in the video. Back to things. Aside from those, you're also gonna want these. You're gonna want pressure dressings. These do have clips. You can replace these with the self-adhesive sports tape. However, it's a bit on the pricier side and you kind of want to save that for the bigger injuries. These work more for internal fractures, bone injuries, things like that. And also, very important, triangle bandages. These bandages, they normally sell in a pack of 3 if you know where to look. Or you can just cut some out of fabric. They're literally what they're called. They're bandages in the shape of a triangle. Many uses which I will talk about later. And be sure to also grab a notebook and a pen. Very important. You're going to want to write down a lot of things when you're out there, such as patient name. I'll cover this in a separate section on cataloging injuries, but very important to have a notebook and a pen. So yeah, a lot of this stuff I'm going to teach you how to make, and you might have around the house. So wait till the end of the video before you start making your shopping list. Now, planning. It is very important to plan before the protest. What you're going to be doing as a street medic is very important. You can't just be running around all distracted. You need to plan. So how you're going to want to plan is you're going to want to reach out to other people. If you have friends that want to be street medics, cool. Talk to them. Plan things out with them. Where you're going to meet, where you're going to end, how the protest is going to go. Reach out to protest leaders to figure out the whole route of the protest, where it starts, where it finishes. Talk to them. Where you're going to start, where you're going to finish, how you're going to get there, and how you're going to leave. What you're going to do when you're there. If you split up, how do you guys reach each other? Things like that. If you want to join a street medic team, check Google, check the events, contact the protest leaders. Most likely, if you're going to an organized protest and you tell the leaders that you want to be part of the medical team, they're already going to have one and they might just put you on there. Another thing that's very important is don't lie about your medical training. If you have a lifeguard certificate, tell them you have a lifeguard certificate. If you're registered as a first responder, tell them that. If you're a nurse, tell them that. Don't be ashamed if you just have no training at all, if you just saw this video, or else they're gonna put you in a situation that's probably gonna be too hard for you to handle. Tell them your training, be honest with them, don't lie, because if you tell them you're something, if you don't, then they're just gonna assume that you know what you're doing in any situation. And they may give you someone with an injury you don't know how to heal, and then you're just there, and you can't say, oh, I don't know. You have someone in front of you. So be honest with them, be honest about your skill level. If you just saw this video, tell them you just saw this video. And yeah, Facebook's a great place to look, Twitter too, even TikTok, if you find a way to search your area on there somehow. That's pretty much it. It's also good to remember that just taking care of injuries is not your only job as a street medic. You have a lot of responsibilities, like you have the taking care of injuries, but you also have to set up medical clinics, possibly in the street. You have to contact actual medical services. You have to talk to patients about aftercare. You have to make sure everyone remains calm, or else there could be more injuries. You have to take care of patients' psychological needs, debrief them. You may have to evacuate them yourself. So there's a lot of things that you have to do that'll be much easier if you just plan ahead. Basically, remain calm, don't leave your patient, know what you're allowed to do legally, and don't do anything you're not comfortable with, and let people know. Anytime a protest like these happens, or riots like these happen, there's always kind of a hierarchy of medical command, and you need to make yourself aware of that hierarchy beforehand. Because when you're in the middle of it, you won't have time to do something like that. Figure out who's in charge of the medics, figure out who has the highest qualifications, and just know where you place yourself and know what you're capable of. And that brings me to my second point. Make sure you're not alone. Find a buddy, make a buddy system. This will either work through the organization that you're contacting if you're going to a planned protest, or even if you're going with a friend. Make sure you're not going to a protest alone, especially if you're going to be a medic, and especially now that we know that police are targeting medics. I'm just going to read off a list right here that I have, that I'll provide at the end of the video, about why it's important to have a buddy. To bring a second set of eyes when you're scanning for patients or dangers. Provide a second perspective or opinion on a situation, being the devil's advocate or voice of caution. Dividing equipment or carrying redundant equipment. Double checking equipment. Reminding the other to eat or drink, very important. Being alert while others rest. Controlling a crowd while the other assists a patient. Preventing people from taking photos or videos of the patient. Being a secondary for two-person CPR. Assisting with moving or carrying a patient. Communicating with EMS or other medics. Or other groups. Debriefing each other at the end of the day and supporting each other's mental health in the long term. These protests, I'm going to talk about psychological more in depth later, but these protests are going to be long and they're going to be damaging, and a lot of people are going to be seeing things that they normally wouldn't in their entire lives. This is a very, very hostile situation, and you need to be ready for it psychologically and even physically. Most people, you shouldn't do this alone, you just shouldn't. Okay, so you have your supplies, you've done your planning, you're at the protest, you have a buddy, and now someone's injured. What do? Well, before you do anything, I want you to remember one very important thing. Stop and take a breath. Just one breath. In, out. 5 seconds. Just calm yourself down. If you just rush into a scene without thinking, yeah, that's good, you have good instincts. However, you're more likely to mess up. When you're doing that, you're lowering your adrenaline and you're clearing your mind, so you're thinking calmly. I've seen a lot of people, even with my certification, make this mistake of just running in too soon, running in recklessly, and they're going so quickly and their mind is racing and they just end up making a mistake. or blanking on something when it's most important. You need to take that few seconds, take a step, take a breath, and just calm yourself down. And then walk in with a clear head. So now we're going to talk about the patient assessment system. Very important system. I want you guys to memorize this. There are 3 steps. Imagine a triangle. That is a triangle. It's late. Anyways, so firstly, scene size up. You need to know what's going on in the scene. Next, primary assessment. Then secondary assessment. So, scene assessment, what is that? Basically, there are 3 parts to this in itself. Safety, numbers, mechanism of injury. Safety. Are you safe? Will you be putting yourself in more danger of entering the scene? Is there anything on the ground or the environment that can harm you? Is there anything that can harm your partner? Is the threat still there? Is it in public or in private? These are all important things that you need to take note of. Next, numbers. Are you alone? How many patients are there? Is there just one person who's injured, or are there multiple people who's injured? How many partners do you have? Are you just with one person, or are there a group of medics? And mechanism of injury. If mechanism of injury was tear gas or a fire, it's probably best not to rush into that environment because it's probably still dangerous. If the mechanism of injury is gunshot, probably best to stay away from that too because you don't want to get shot. If someone's run over by a car, same thing. Things like that. It's important. You can go through countless situations and what'll happen will be different. But it's important to keep these things to mind. Another important thing to remember about the scene size up is why you need to stay out of danger. You cannot help anyone if you have a possibility of becoming a casualty yourself. Don't rush into a situation without taking in information from your surroundings. If someone was hit by a car, make sure that the car is no longer a threat to anyone. If someone was shot by some crazy nationalist, make sure that that person is no longer a danger to yourself. Again, you cannot help anyone if you yourself become injured. Another important thing is your own security. Again, make sure to wear a mask. Make sure to wear gloves, face shield, padding, whatever you need. Keep yourself safe. You are the responder and your own safety is extremely important. Again, you cannot help anyone if you're injured. And about the mechanism of injury, if you didn't see what happened and you can't sort of glean information from the situation itself, ask around. Maybe someone knows. Send your partner to ask around. This is another reason why it's important to have a buddy. Another important thing to keep in mind is consent. If you're coming up to someone and you just start performing first aid on them, no. Ask their consent. Make sure you have their consent before performing first aid. Make sure you introduce yourself. Tell them who you are. Inform them that you're there to help them. Say, hey, I'm a street medic, or whatever qualification you have. And then ask, hey, I'm a street medic. My name is this. Can I help you with your injuries? Yes. Now, if the person is unconscious, consent can be a bit hard to get, obviously. So you're going to need to test their level of consciousness. If they're unconscious, start off with a vocal stimulus. Say hello, scream, tap on the ground around them. If they don't respond to auditory stimulus, switch to maybe tapping them on the shoulders. Hey, wake up. Then maybe pinch them a bit, see if they respond to pain. If they don't respond to any of it, then you're going to want to try pain stimulus. Try maybe pinching them or shaking them. If that doesn't wake them up, then in this special case, you're going to want to work off of what is called implied consent. This is a very special case since they are definitely unconscious. You're going to want to have to make sure that they're definitely unconscious and they are in a life-threatening situation. Then you move on to the second part of the patient assessment system. Okay, so now we're going to talk about the primary assessment, which is the second part of the patient assessment system. Now this part also has 3 steps: circulation, breathing, level of consciousness. So circulation is essentially, is there a pulse? You could check for pulse right here below the neck or under the thumb here. There's also a place at the base of the ankle. There's plenty of places to look for a pulse. Practice on this is something you can practice on yourself. Look up online if you can't. Normally you should feel your muscle right here and then your throat here in between. Go from the muscle, slide down a bit until you find the crease, press down, and you should find your pulse. If not, same concept here. Go a little bit inwards till you find your tendon. Right next to your tendon, under the base of your thumb, you should find the pulse here too. So, is there a pulse? That is the first part of circulation. Second part, is there major bleeding? If there is. Major bleeding is essentially if they're bleeding more and there's a pile of blood on the ground bigger than about this. It should be about the size of your fist. If there's more blood than that, then it's considered major bleeding and that needs to be attended to immediately. But always check pulse first. Second part of the primary assessment is airway. Is their airway blocked and are they breathing? The second part of the primary assessment is respiration. Do they have an open airway? Is their airway blocked? Are they breathing? And if they are breathing normally? If their breathing sounds a bit jagged or like muffled, then that might be a problem. They might be having an asthma attack, and we'll talk about the different pulmonary issues later. But it's important to keep track of that because that's one of the major vital systems between circulation, respiration, and the nervous system. An important thing to keep in mind about the patient assessment system, however, is that it's made in a step-by-step basis. If there's a problem in the scene assessment, you do not move on to the primary assessment. If there's a problem in the primary assessment, you do not move on to the secondary assessment. You always have to assess the problem that is the highest priority, and that goes by the order of the patient assessment system. So in the secondary assessment, it's also made up of three. There's the physical assessment. Physical assessment is essentially what we call a wet check. You have to have gloves on for this, and you start head to toe, checking the patient if they're unconscious. If they are conscious, ask for their consent, of course. You have to check, press hard, pulsate a little bit, see, and then after you're done a certain body part, check your hands. It's called a wet check because you're checking for blood, but at the same time, you're also checking for any bone fractures, tears, anything like that. Anything abnormal, bumps, bruises. But most importantly, remember to check every time, because if you're checking the whole body at once and you see blood, you don't know where the blood's coming from. This is normally done after the things in the primary assessment are taken care of. So primary assessment, then secondary assessment. So there's the wet check. Go throughout the body. If you find an issue, write it down, tell your partner about it, but don't assume that that's the only thing. If someone gets shot by a rubber bullet in the chest and then they fall down and they hit their head, but they also break their leg, well, right there you have about 3 different sites of injury. Next, we have sample history. Sample is basically signs and symptoms. What's wrong with the patient? What can you see? What symptoms are they having if they're awake? Then it's A, allergies. At this point, you should either be talking to a family member, or if they're conscious to them, what are their allergies? And then there's M, medication. What medication they're on, what medication they took, what medication they're allergic to. Put that in the A with allergies. A lot of people forget that they're allergic to medication. They just jump straight to food. P, pertinent history. What happened? Did they fall down 2 days ago? Did they have a concussion a week ago? Do they currently have the flu? Anything do you think is pertinent to their current situation? Have them tell you, ask them about it. L, last ins and outs. Basically, when's the last time they ate, when's the last time they drank, and when's the last time they went to the bathroom? There could be people can go unconscious if they have certain things like constipation or bladder problems, but it could also go unconscious from lack of food, dehydration, and it's very important to keep track of those things. And then E, events. What happened to put them in the situation that they're currently in? Were they shot? Were they tear gassed? Were they hit? Did they just fall down? Do they not know? Whatever it is, have them tell you. And if they don't know, then ask someone around them. Ask if there's any witnesses to what happened. Don't just assume that if the patient doesn't know if the patient's unconscious, it ends there. The third part of the secondary assessment is their vital signs. What is their pulse? Write down what their BPM is, beats per minute. Same with the breaths per minute. BPM should be around 80 to I think 120. Well, depends on the age group, depends on the gender. Breath rate should be around 20 to 25. If it's a bit over, it's a bit under, it doesn't really matter that much, but keep track of. So we have the heart rate, we have the breathing rate, and you also have to check skin. Is there skin color, temperature, and moisture? And I don't mean like race, ethnicity. I mean like, is their skin turning blue? Has circulation been cut off somewhere? Is it abnormally red? Is there burns anywhere? Is their skin abnormally hot or abnormally cold? Is it abnormally dry, or are they sweating profusely? These are all things you need to know. So moisture, for example, if it's too dry, that may be a sign of dehydration. Or if it's too wet, then that may be a sign of exhaustion and also could lead to dehydration. So these are also things you need to keep in mind. Vital signs also includes the level of consciousness. Sample history is normally taken afterwards and after the primary assessment, meaning that the person should either be with a paramedic or they're not unconscious, in which case check the level of consciousness. Are they responsive? Are they awake? Are they responsive to vocal stimulus? P, are they responsive to pain stimulus, or are they unconscious? Now I was going to talk about recording injuries later, and I still will. But for the primary assessment system, it's important to have a notebook, and especially a SOAP notebook. These you can buy from a website. The association that I did my training at is called the Wilderness Medical Associates International, and they have this fun little chart where you can write the patient's information, their height, their age, emergency contact, birthday, sex, weight, just phone number. And then down here for sample, we have signs, symptoms, allergies, medication they could be on, pertinent history, physical exam, did you notice anything in the physical exam, and then their vital signs. They have pretty much everything, and they even have a diagram of the body where you can circle where the injury is. Then they have on the back the assessment list, anticipated problems, and treatment plan that you have. This book has dozens of notes, and you can just rip the page out after writing in all the information for a given patient, and make sure that this is with the person. If they're going off to a higher level of care, a paramedic, nurse, doctor, make sure they have this information. This can really decide the difference between if this person survives or if this person in condition worsens before they get the help they need. And if they don't, I don't care what you need to do, put it on their chest, staple it onto the person. It doesn't really matter, just get this to the next level of care. I will be putting a link in the comments to a PDF of where you can get this exact sheet. You could print out a bunch, you could just write them yourself, write this stuff down yourself on a piece of paper beforehand. Like I said, planning is very important. It could save you a lot of time and relieve a lot of pressure, because if you're new and if you're just trying to memorize like the level of consciousness scale, sample, all the vital signs, things like that, this can really help you. Another important thing is if there's a problem with the patient, or if there is a patient in the first place, call 911, ask for the ambulance, and tell them exactly what is wrong with the patient. And don't just stop there. If the situation changes, call them again and tell them, hey, I called before for this person for this reason. Well, now this person has this. So, and they'll probably bump you up the list. Don't just assume someone else is going to call. And if you don't have time to do it yourself and you don't have a partner to do it for you, point to someone directly and tell them, hey, you, call 911. Tell them that this person has this, and ask for an ambulance. Because don't just expect someone else to call. It's called the bystander effect for a reason. Everyone's just going to stand there assuming someone else is going to do something when they won't. And if you're on call with a paramedic, with a doctor, with 911, 1, tell them what's wrong with the patient. 2, tell them where you are. 3, tell them who you are. Are you a medic? What are your qualifications? What's happening? And do not hang up unless they tell you to hang up. That's another important thing. They will most likely stay on the phone with you, and if they don't, well, then that means the situation isn't that bad or they're flooded with calls. Either way, if the situation does change, call them back again. Another important thing is that normally in situations where there are a lot of casualties, it shouldn't really go to the secondary assessment. Let me explain. If there's a lot of people, you kind of need to do something called triage, which basically means highest priority patient gets highest priority care. Let me rephrase. If you're dealing with a patient and there's nothing wrong with the primary assessment, and there's someone else on the floor next to them in even worse condition, don't stay with that patient. Go help the other person. If there's two people and if there's a team of medics, it's a totally different situation. Don't leave your patient. But generally speaking, in incidents of mass casualties, where a lot of people are getting tear gassed and a lot of people are getting shot with rubber bullets, it's unwise to just stay with one person if they're very, very low injury. And that moves on to the next topic, which I will be talking about, which is patient evacuation. So patient evacuation is generally a loose term, meaning moving a patient from one situation to another where they can receive care. This is another point that kind of supports the fact that you need to plan a lot. There's a lot of times where doctors, people, EMS workers, doctors, nurses will form makeshift clinics nearby in people's homes, put up tents, things like that to help people. And unless you do your research, unless you plan, unless you contact the protest managers, you won't know where this is to bring the person there or to instruct the person to go there. So this is another thing that you need to plan for, you need to understand. And again, plan evacuation points throughout your protest. Get a map. Look, if you know the area, look at where the protest is going to start, where it's planning to end, and look at different places where you can imagine it's being stopped, and look at ways to get out of there. A lot of cops will do a thing where they kind of block you into a certain area. I'm sure you've seen the videos of this happening. You want to avoid that at all costs. If you're in a dangerous situation and you need to evacuate a patient, find the way out of there. Basically, you should only evacuate patients if absolutely necessary. But if you do evacuate them and you do need to evacuate them, if the situation becomes way too unsafe, make sure you have that person's consent and tell them what they need to do. Communicate with them as they're doing it. It's very important to remain in constant communication because you don't know when an incident can go from manageable to just more dangerous. Now, I'm not going to cover like unconscious patient evacuations, which involves patient drags and patient carries, which normally rely on multiple people, because that's very complex and I need to show you visually and I don't really have anyone to demonstrate with. And even then, I don't really trust the training that can be given through a video anyways. But here's something you need to know. If there is a mechanism of injury, which means something that caused the injury, where there's a possibility that their spinal cord is injured, do not move them. If they fell, if they were hit by a car, if even they fell in a bad way, if they fell on a rock, if there's a mechanism, if there's any possibility that they injured their spine, do not move them. There is a test that you can use to determine if someone has a spine injury. I will not be teaching it because, again, that requires someone to demonstrate on, and it requires practice and training, and unfortunately there's only so much we can do through video. But basically what I'm saying is, if there is a possibility that someone injured their spine, do not move them unless absolutely necessary. Meaning, if they're bleeding out and they're on the brink of death, then possibly move them, but be very careful not to move the spine. I'll put a link in the description about a technique, how to maneuver the body, but I probably won't do more than that. Be very careful though. Like, only if someone's on the brink of death, on the brink of death, should you move them. If someone has a minor injury or you don't know why they're unconscious, and you move them when they have a spine injury, they could end up dying, they could end up paralyzed completely, or who knows what else. the nervous system is very fragile, especially the spinal cord. Now, there's a whole acronym around what can cause these things called stop beats. Look into it if you want. I'm not going to go through every single point. I will mostly be focusing on traumatic brain injuries involving increased intracranial pressure. Basically, what happens if there's a traumatic brain injury, what could happen is that pressure inside the brain will start bleeding. And when that happens, pressure inside the brain will start to increase and basically suffocate your brain from the inside. At first, what's going to happen is the patient's going to feel a really bad headache. They're going to be a bit dizzy. They're going to be less responsive, and their head's going to kill. Right after that, they're going to start vomiting profusely. After that, they'll fall unconscious. You need to catch this immediately. And if you have the slightest inclination that have rising intracranial pressure, you need to call that in immediately, because that can go from okay to very bad really quickly. And if there was a traumatic brain injury, mention that to whoever is higher above you. Mention that to 911, mention that to EMS, mention that to the nearest doctor. Traumatic brain injuries are no joke, and they could really just turn on a dime. Normally, and in first aid trainings, they'll probably teach you about things like non-traumatic brain injuries, like strokes, neurotoxins, hypothermia, hypoxia, electrical injuries, epilepsy, things like that. Feel free to look into it. It may be important information to know. However, it's not going to be very specific to what'll be caused in the street, what'll be happening during these protests. It's not really caused by a trauma, so I won't really be covering it. However, again, I will be including this in the link section in the bio. And when you're doing the wet check, make sure to check for internal bleeding in the abdomen. You do this by, You do this by finding the belly button and finding 4 distinct places in the stomach and pressing down. Top, bottom. Make sure to press down hard enough to see if there's anything abnormal. If it is abnormally tough and abnormally rigid, and it's not like muscle tough, like it's hard, like rock hard, assume there's internal bleeding. If the person has, just assume it's internal bleeding. Now, time for basic life support. Basic life support falls in the primary assessment if there's a problem. We'll start off with respiration. Respiration, you can remember the acronym PROP, P-R-O-P. P, position. Make sure the neck is twisted back to allow the airway to open. So there's a So basically what you want to do is a chin lift and a jaw thrust. So you want to lift the chin up to allow the airway to open, and you want to thrust the jaw forward using both hands and your thumb to push the jaw forward. This will really open up the airway and allow for proper breathing. Next are reassurance. If the person is awake and they're having a panic attack, just calm them into breathing. Do pursed lip breathing, where you're breathing with them and you're telling them to purse their lips. Like, have them breathe like that. It'll really slow down the breathing and get it back on track to a normal rhythm. Try breathing with them. Just reassure them. That if they're unconscious, that brings us to O. If you're in a clinic setting or somewhere where you have access to an oxygen tank, give them oxygen. O, oxygen. And then the last one is P, positive pressure ventilation. This is essentially CPR, which I will cover very soon. Then that brings us to circulation. Circulation is either the heart has stopped, there's no pulse, or major bleeding. If there's major bleeding, direct pressure, no indirect pressure. If it's really major bleeding, we're going to go over tourniquets later, but basically stop the bleeding any way you can. Which brings us to CPR. I will not be teaching you CPR. You can find countless videos how to do CPR. But the CPR, don't be afraid to crack the ribs while doing CPR. I can't demonstrate it myself. Yes, if someone's unconscious and they don't have a pulse, do CPR. That's what it helps the respiratory system, it helps the circulatory system, and it keeps the nervous system from just quitting. Moving on to the nervous system for basic life support. Like I said, I'm going to put the acronym stop beats over here. I'm not going to go through every one of them. I will post a link talking about every one of them in detail. I just don't think that it's something a lot of people will run into. But if you are interested, go check it out. Lastly, I'll just do an overview. So for basic life support, for the primary assessment, problem with circulation, either stop the bleeding. If there's no pulse, immediately go into CPR unless you see a lot of blood. For respiratory, if the airway is blocked, open the airway. If there's something in the airway, try to take it out. If you can't take it out, again, CPR. And for your nervous system, check the nervous system. Try not to damage the spine, try not to move it around too much. But basically that's all it. Problem with circulation, no pulse, unconscious, CPR. Not breathing, open the airway, make sure there's nothing in it, CPR. If there's major bleeding, stop the major bleeding. That's pretty much it. Now, done with the first quarter of the segment. It was a bit slow, I admit. I'll admit. Mostly just planning, coordination, and organization. Now it's going to start picking up and I'll start giving demonstrations, specific things to learn about, specific tactics you'll do, and specific tools you will use in the field. So now that we're going to be talking about more common injuries that you're going to see, you have to know two things: how to treat the cause and how to treat the symptoms. First, you have to identify the cause. If someone fell, hurt themselves, and they hurt their knee, you have to find out what the cause is. Is it a dislocation? Is there swelling? Those are both causes that you have to treat. You also have to treat the symptoms. How are you going to treat the symptoms? You have to bring down the swelling with ice, maybe treat the pain with a pain medication, and we're going to go over medications right now. So now we're going to be talking about medication to bring to the field. There are two types we're going to be talking about today, which is non-opioid pain medication and NSAIDs, non-steroid anti-inflammatory drugs. I have them here. Okay, so for the non-steroid anti-inflammatory medication, most commonly is Advil, ibuprofen. There's also another brand I can't really remember the name of. But basically, this deals with inflammation, and it is a non-steroid, and it doesn't really cause that much harm, but only give it to someone if they're in excruciating pain. For non-opioid medications, we have acetaminophen, or most commonly known as Tylenol. This deals with pain, but does not reduce swelling. Another non-opioid medication other than Tylenol, other than acetaminophen, is also paracetamol, which they most commonly have in other countries. It's not that popular in North America, but it does exist. If you have that instead of Tylenol, it works. The difference between the two is that for ibuprofen, yes, it does decrease swelling, but it also increases bleeding. So I don't suggest giving it to a patient if they have some form of major bleeding, because it can increase bleeding and also upset the stomach. Tylenol has more of an issue with liver. So if there's some sort of toxicity poisoning that's a cause of it, somehow some people are getting poisoned at protest, which I'll refer to later in the safety section. But I would not suggest giving Tylenol to them because it does harm the liver, whereas Advil harms the stomach. Some of you may have noticed I also have aspirin in here, aspirin also known as ASA. It is a blood thinner as well as a pain medication. I do not suggest giving it to people who are injured because you don't know the extent of that injury. It is blood thinning. So if they have internal bleeding, if they have hemorrhaging somewhere in their bodies, major bleeding, anything like that, it will make it worse. You don't know the cause. You don't know what can happen later. It's just too risky to bring to the field. I have it here for other reasons, but I wouldn't risk it. Before using medication or bringing medication, you should know dosages, side effects, basically everything you need to know about this drug. Most of it can get gleaned from reading the bottle, but some research is required. Most of the information can be gleaned by just reading the bottle, but you can always get more information doing your own research online. You have to know dosages, however, so ibuprofen I believe is about 400 to 800 milligrams, whereas acetaminophen is about 320 to 500 milligrams for an adult dosage, not a child dosage. Try not to go over the maximum as much as you can, and try to stay as low as possible. So now we're going to move on to musculoskeletal injuries. There's different types of injuries that can happen: bone, cartilage, joint, ligament. I'm not going to go into all of them in detail, but you should just learn the anatomy of a bone from links in the description below. Firstly, I'd like to mention that not all musculoskeletal injuries can be identified just by bones breaking or joints dislocating. There can also be problems with the neurovascular bundle, which is the artery, veins, and nerves intertwined. They could get twisted, bent, blocked somehow, and that could cause a lot of pain, ischemia, even internal bleeding. Another thing about musculoskeletal injuries is there's something called high risk and low risk injuries. Don't just assume that there's no injury because you can't see it or feel it. If someone tells you that they're in pain there, assume there's an injury. Always assume that there is an injury, never make the assumption that there isn't one. Not to mention there's 3 types of mechanisms for those types of injuries. It could be from a direct trauma, so if someone was shot with a rubber bullet, hit by a car, something like that. Indirect trauma, meaning they just moved their arm the wrong way, holding up a sign, or they were running and they twisted their ankle, something like that. And then there is just overuse. If someone's walking for a long time during these protests, someone's running from the cops for longer than they're used to, adrenaline takes over, they don't know what's happening, they can have an injury just due to overuse. So it's very important to just always assume that there is an injury there. For musculoskeletal injuries, I want you to remember another acronym. Yes, I know a lot of acronyms. RICE. Rest, ice, compression, elevation. This is only for somewhat stable injuries, meaning you can't see the deformity. You can put it in a sling. I'll teach you how to make that in a second. For comfort, if there's some form of swelling, give them ibuprofen, a little bit of ibuprofen. And that's pretty much it. Follow-up is needed, and be sure to always check circulation below the rate of injury. If someone injures their forearm here, check the pressure, check the pulse underneath the forearm, because there could be a problem that was caused here. It could compress a nerve, it could stop an artery, and you have to constantly keep checking the pulse here to make sure that there isn't a form of ischemia that just stops, or else that person could end up losing a hand if you do not give the proper attention to the specific type of injury. Always be sure to check pulse below the site of injury, essentially. Right, take 2, since my phone died in the middle of the last recording. Okay, so now we're going to move on to actually making splints for musculoskeletal injuries. The first one we're going to talk about is unstable joint injuries. Now, I will teach you how to fix dislocations for simple joints. However, not all joints are simple. And for unsimple joints that have complex injuries, you're not going to want to move it. So let's say, hypothetically, I fall, I dislocate my wrist, and it's like this. Now, you're going to want to splint this in its position unless a few things. Unless 1, it's impossible to splint it in that position, or 2, it's causing ischemia. Ischemia is essentially when something happens, like the muscles are compressing the neurovascular bundle, and you can't feel your hand. And this is why I said skin is a good vital sign, because if ischemia is essentially, it's cutting off circulation to that body part. And skin's a good vital sign, because if that's happening, then your hand will be turning blue and then purple, and then that will lead to necrosis, which is basically death, in a lot of cases, which means your hand will probably need to be amputated. And we don't want that. So unless there is that ischemia forming, splint in position. If there is ischemia, you're going to want to move it, and not just move it quickly like this, or even slowly. You're going to want to do something called traction into position. So traction is you're pulling it, and you're moving it slowly back into position. What you're doing is you're pulling it so that whatever pressure is on the nerves and whatever pressure is on the arteries or veins, you're removing that pressure, and then you're putting it back into position. From there, you can resplint it, but however, this is not a quick process. Take your time with it. Even with the way I did it slowly, it was still quick. I want you to take a good minute or 2 doing this, and only if you have to do it for cases like this. So now the actual splinting part. How would you splint this in position? Well, you can really, let's see. You just kind of need any stick or hard object. I'm using this wooden spoon. Put it here at the base of the injury. Notice how there's a crevice here, so you can't really splint in position. Well, you kind of can. If you just have an extra pressure bandage or something like that, do it here. This one's a big, make it smaller if you have to. This is why I said it's good to have things like cloth or triangle bandages available. If you put that under the injury here, perfect size to splint in position. This can also become annoying, so you're going to want to wrap the stick you're using, especially if it's wood or something like metal. You don't want infection in another cloth. I don't actually have that many available on me right now, so I'm just going to use this sock, this freshly cleaned sock there, and then you're just going to wrap that in a pressure bandage altogether. I'm going to do this off camera because it's a bit hard to do on yourself. Okay, so I splitted it, a bit hanging, it doesn't really matter. It's in position. I secured it using the clips that it came with. I can't really bend my wrist, I can't really move it around, which means I will not accidentally injure it further. You can use these clips, you can tie it to the other end, you can just tie a knot. There's a lot of creative solutions. I'm just going to use the clips because this one came with them. But yes, this is how you make a splint. Now, in order to avoid further injury, because right now I could just kind of move it around, you're going to also want to make a sling, which I will now teach you how to do, using a triangle bandage. Okay, one of the pins just popped off. You're going to want to avoid that happening. I did not put it on correctly because, again, doing this to yourself is hard. No, wait, I did. The metal is just cheap and it bended because this is from the dollar store. Okay, so for a splint, triangle bandage, you're going to want to tie a knot at the end of the wider side of the triangle. It should be the same size in each, but in case it isn't the wider side, you tie a knot. That knot is going to go up the elbow of the patient. And what you're going to want to do from here, I've never really done this on myself, here and here, and then you just tie a knot on the back. This way it makes a sling. So now there's a splint and there's a sling, and it keeps it from causing further injury. This is for a joint issue on arm. This can also go on the leg. Of course you won't use a sling on your leg, but you will use a splint. For the leg, however, you will not be using one stick, but you will be using two since it is larger. For the knee, and if there is a joint injury on the knee, that I will teach you how to relocate that. However, if you cannot, it's best to put the pressure underneath the joint of the knee. So let's say this is my knee, this is the knee joint under here. Don't just put it flat, because that's when the knee is hyperextended, and you don't want to hyperextend the knee. Even if there isn't a joint injury, you do not want to hyperextend your knee. So just put it there, balance it in between the two splints. Put it there, when you're wrapping it, put bandage under the knee. The two splints will be on the side of the knee, and the bandage will be under the knee. It'll just keep it a bit bent so that circulation is ideal if there's a problem with the femur or any other bone in the leg. That was for a joint. For joint splints, it needs to be complete if you can do a few things. One, it has to secure the bone underneath and the bone above it. So there, I put a clot here, but I also put the stick all the way up to my hand, all the way up to here, to sort of secure, well, I did it sideways, to secure it. Normally, you give something to put in the hand that they would wrap around. This time, you could use the end of a sock, and you would wrap the hand around too to keep it from moving. You have to secure not only the site of injury, but what is above it and what is below. For joints, what's above it is a long bone, and what's below it is the hand. For a long bone injury, it is the same concept. You have to secure the bone itself. For long bone injuries, same thing. You can traction it into position. It does take a bit longer than joints, but you only have to do it with the same situations that I mentioned before, either ischemia or it's hard to splint. And traction into position takes longer. You have to really take your time with this one. You can mess up badly and only do it if absolutely necessary. But this stick is a bit short if I would have damaged my forearm, because it needs to secure the elbow and the wrist to keep it from moving. And then you would just splint it normally. Also, remember to check circulation. Check circulation before you're doing a splint, and check circulation after you're doing a splint. Check circulation both above and below. You can check the above circulation with your neck, and you can check the below. If there's a joint injury on the wrist, You can't really check here. You can check with your thumb though. There is a pulse in your thumb, just above and below any position, doesn't matter. But you have to check circulation before or after. You have to make sure it's completely immobile, and you have to secure whatever is above and below the site of injury. Okay, so I just did a splint for the forearm, as I mentioned before. Securing the hand here, you can still move your fingers, but most of the hand is immobile. You still want to splint the joints at a certain angle, because if it's straight, okay, I can't move it here, but if it's straight like this, it's flat. That's not how your bones are normally positioned. There's normally a little bit of bend, and that works everywhere. You don't want to hyperextend, you want it a little bit of bend. That's why we generally do the sling. But this is what it would generally look like. You have a place to hold your hand, but you can still move your fingers. This one, I'm not going to bother immobilizing the elbow for this one, because it'll be in a sling, and that itself will immobilize the elbow. But that's pretty much it for slings in this. I'll show you an example of how to do it for your knee in the next clip. Now, if something happens after you did the split, like ischemia is forming, there's more pain, swelling, then what you want to do is undo the splint. Not completely, just loosen it. Maybe the splint is causing an issue, maybe it's too tight. Try not to make it too tight, but it has to be like tight enough. But if there are problems after, then assume it's either the splint or there's something that you missed. So then you're going to want to traction again and see if that solves the issue. Constant just traction and try to re-put it in position. Honestly, if this is too much to handle, I really suggest, if it's high risk, meaning that there's constant ischemia, the person is developing a fever, the pain is excruciating, or even if it's just an open fracture, try to get it to the next level of care as soon as possible. Whether that is your superior on your medic team, whether that is someone who has higher medical training than you, a nurse, an EMT, someone else out there, or 911, doesn't matter, you have to get them to the next level of care. Doing this does help, yes, but then again, this does not substitute real training. Remember to keep employing the acronym ICE for these: rest, ice, compression, elevation. For these injuries, if compression is too tight, make it looser, but you still need a certain amount of compression to keep the injury in place. And it is a high-risk injury, again, for not only the things I just mentioned, but also the type of fracture. Generally, if the fracture is closer to your body, it means it is higher risk. So like if I have a finger fracture, it's not as high risk as if I fractured like my shoulder or my collarbone. If it's a pelvic fracture or a femur fracture, meaning that they can't move their leg, whether it's an open fracture or not, pelvic fracture, it will be excruciatingly painful. That is high risk immediately. There's a lot of joints, there's a lot of tendons, a lot of nerves surrounding both the femur and the pelvis, and a fracture there is immediately high risk, and you're going to want to pass it off as soon as possible. Another thing I want you guys to look out for is something called compartment syndrome. Compartment syndrome is essentially, to summarize, when a certain area of injury is swelling inside. It swells so much that like it causes excruciating pain. The pain is not proportional to the type of injury it is. It's just a lot. It's mostly just pain, but it's swelling, and it could lead to ischemia, which eventually leads to something called infarction, which is cellular death. And you want to get that to emergency care as soon as possible. So be aware of compartment syndrome, look into it, and just know what it is. And as soon as you spot it, send that off. That is high risk as well as everything else I just mentioned. That's not something I'm even trained to handle. You have to send that off to surgical care. Now we're going to talk about dislocations. I've already mentioned more complex dislocations and how to deal with them, how to be aware of ischemia. It's the same amount of threat, same amount of like caution that you need to be aware of. But there are more minor dislocations that are called simple dislocations that I'll teach you about today. So dislocations essentially is there's discomfort, deformity, and a lot of pain. So if you could still feel a pulse underneath the dislocation, and it's not in a major group like the femur, the pelvis, then there's a possibility that you're going to want to deal with that yourself instead of sending it to a higher person in charge, a higher level of care. Then again, it's always best to send it to a hospital, to send it to someone else higher, but sometimes you're going to be in a situation during these protests and during these riots, where there is no one else, where you guys are blocked in by the cops, they're not letting EMS in, they're not letting ambulance in. And essentially it's just easier to do it yourself. I'm not saying you should, but if you are in that situation, I will teach you how to deal with simple dislocations. Simple dislocations that I'll be talking about are 3 in particular: shoulder dislocations, finger dislocations, and patella dislocations. We'll start off with fingers. So for fingers, it's very simple. It's literally just traction into position, pull, not too hard, and slowly put it back into the position, close it, and then you're going to want to splint it. Normally you'd splint with a stick, however, since it's fingers, you always want to splint it to the adjacent finger. So if this one's broken into this one, this one, this one, and this one with this one. So let's say I just did traction into position, you're going to want to use some type of medical tape. This time I'm using sports tape, which I've mentioned before, self-adhesive. So like it's not sticky at all, but it does stick to itself. This I got at the dollar store, which is why I'm using it, because they sell smaller rolls because they're cheap. That's basically it. Again, check. You're not going to be able to check pulse, but what you're going to do is cap refills, which means you press, it's white, it turns red. That means circulation is decent. And this tape rips easily. Make sure it's not too tight. If it's too tight, you can always loosen it a bit. Dislocations, for the most part, unless they cause some form of ischemia, it's just a lot of pain. So that's how you splint a finger dislocation. Shoulder dislocations, I'm going to include a bunch of diagrams if I know how. This may just be a voiceover of diagrams. But there are 3 different methods that I'm just going to teach you 2. So the first one is called the baseball method. I'm going to use my diagram. So the baseball position. What you're going to want to do is, hopefully I can get a picture up here, if not it'll be the full screen. Slowly abduct and rotate the arm away from the body. So if there's a shoulder dislocation, someone is lying down, slowly lift the arm, the whole body's on the floor, lift the arm. I'm not going to lift it, I'm just going to use my strength because I can't reach that far. Lift and just move it away from the body and mimic a form of like throwing motion. This should generally just pop back into place unless it was caused by a harsh impact. If it just fell out of place, which can happen a lot, things happen, people are throwing objects, you may get hit by an object, you may fall down, you may be holding up a sign and it just falls out of place. This method should work. That's the first method, the baseball method. You essentially just want to do this, and I'm really going quickly here, but you're going to want to do this to the person who's dislocated very, very slowly, and you're going to want to massage the area where it's dislocated a lot. This whole process should take about 10 to 15 minutes, but you're going to want to really relax the muscles around here. What happened is it dislocated because in an instant, at an intense movement, and if you relax the muscles a lot, doing soft massages around the injury, there's a chance that it might just pop into place by itself. If not, then do this method while massaging very, very slowly, and it should go back into place. That's the first method. The second method is essentially the same thing. Let me just move my camera a bit. Yes, I'm on a chair. But the arm is going to be, I hope you guys can see, here. And you're just going to want to rotate it outwards. This I'm going to include it as the same step because it's very simple. But it's basically just like this, except instead of doing this, the arm is flat against the patient, and you're going to move it like this. Try not to extend it out too far, because that might just pop it out even more. But just like this, and that might slide into place. The next method I'm going to be displaying is called the Cunningham method. Will probably take the longest, and it's probably the most effective. I might actually just insert a video into this clip, and that'll play now. Of course, after a shoulder dislocation, you're going to want to put the arm in a sling, and let me just show you 1 second. Okay, so I showed you how to make this basic sling with a triangle bandage. However, This sling can still allow for movement just in this direction. Yes, it immobilizes the arm, but you can still move it like this, which is why it's important to have another bandage. And what you're going to want to do is tie that around the person, including the arm and the sling, so it can't move forward. This just offers a bit more of stability, keeping the injury in place, keeping it from moving in case someone needs to run and they just out of instinct move their shoulder, which can damage it more. For a dislocation like this, even with the finger dislocation, even if you put it back in place, you're going to want to go to the hospital immediately. And again, keep checking circulation. Check circulation before you do it, check circulation after you do it, check circulation 10 minutes after, 5 minutes after. Keep checking circulation until you go to a hospital and get it x-rayed to see if there's any damage that could have been caused either during the dislocation or after it was put back into place. Nothing is foolproof. And again, you guys can't really practice this over the screen. You just want to make sure that everything's okay. This is just first aid training. Yes, it's very advanced first aid training, street medic training, because there's probably not going to be any paramedics there. However, it is important to remember that this is not the end of care. This is just the primary care. After this, you send the person to a hospital, to a doctor, to get the second level of care. So that moves us to patella dislocations. So the patella is essentially just a little disc that sits on your knee. Sometimes if you fall badly or if you're just running and it twists out of place, it can come loose and just flop to the side. And normally it's the side exterior to you. So what you're going to want to do this one is just pop it back in. Pop. That's basically it. The same thing applies, splint sent to hospital, but essentially just pop. However, when the patella does, if the patella does dislocate, you can just pop it back into place. However, it's not going to be that stable. It doesn't, a joint should never really pop out of place. If it does, then that's probably just a symptom of a larger cause, like a weak muscles around. They might need physio. They probably will need physio, actually. But yeah, it's just pop. For each one of these dislocations, I highly suggest giving them some NSAIDs, non-steroid anti-inflammatory medication, like ibuprofen, something like that, just because there will be a lot of swelling. So just pop it back into place. Don't expect too much swelling, but there will be a small amount of it. That much is natural. If it gets to be a bit worrisome, then send them to the hospital. You should send them to the hospital anyways, but like send them faster. But yeah, also wrap the joints, all of them. I already said shoulder this, but I want to make clear the patella too. Wrap everything. Check pulse. Non-steroid anti-inflammatory medication. And just keep monitoring. Again, I just want to be clear that you should only do these methods, the traction into position, the other methods I mentioned, for these 3 places. Don't try them anywhere else. Like for example, it's very hard to discern between a hip dislocation and a pelvic fracture. So if you try traction into position for a hip dislocation, that may cause a lot of internal bleeding and that may cause a lot more damage. The reason I learned these ones is because I learned them in Wilderness First Responder training. Wilderness First Responder, you kind of have a long distance between you and the nearest hospital, so you want to take care of things as quickly as possible in a way that calculates the benefits that outweigh the risks. So when the benefits outweigh the risks, then you implement them. But if you're right next to a hospital and you think, hey, it might be fun to just pop this dislocation back into place, just don't do it. Like, this is like in case of emergency stuff. Don't just do it because you think it's fun. Don't just do it because you think it's optional. Do it because you have to. I think this is a good place to add. This is just for educational purposes and I claim no liability for any of this. So now everyone's favorite segment, wounds. So we're going to talk about 3 different types of wounds: low risk, mid risk, and high risk wounds. For the low risk, it'll be something along the lines of this: a general slash with blood, maybe a cut, maybe something more. What you're going to want to do is prepare a antiseptic solution. My personal favorite is a 1% solution of providone iodine. You can buy a solution of providone iodine, about 10% solution, at any drugstore really. But you only really need a 1% solution. Higher will just act like rubbing alcohol will. It will kill everything and it'll even damage healthy tissue. So what you're going to want to do with this one, as I mentioned before, is dilute it with copious amounts of water. It should look the same consistency as iced tea. This one's a few days old, so it's not viable anymore, and it's a bit lighter. But you're going to want it to be dark enough that it shares a similar consistency to iced tea, not dark enough that it's like can be mistaken for Coca-Cola. That's the general consensus of what you want to do. And what you want to do with the solution is clean the wound. So for an injury like this one, it is a low-risk wound. So how you're going to clean it, you're not going to go in there and start just rummaging around on the tissue. That is extremely painful. What you're going to want to do is clean it with water and pressure. But what I mean by that is get a bottle like this, a squeeze bottle. If you don't have one, you can always get a syringe. They sell, this one I think I got from a container of Advil, liquid Advil. You can make the solution in a water bottle because, like I said, it's very versatile. Soak it up, and you're going to want to clean the wound. You're also going to want to have some type of rag. It's great to have a copious amount of triangle bandages. You can cut rags out of t-shirts, really anything you need. Soak it in the solution and clean around the wound, and then use this to clean in the wound. And I don't mean like putting this in the wound, I mean like spraying at an angle that'll clean out the wound. That is for low risk wounds. After that, what you're gonna want to do is press it closed a bit. If you have even the slightest amount of inclination that there's something in there, you're gonna want to clean inside the wound. Water pressure may not be enough alone. You're gonna need to use a lot of the solution. I say about a liter for a wound this size, which is why it's good to carry around this solution in water bottles rather than pre-making the solution. You can pre-make it. It's a great time saver, but it's better to also have this solution with you, and there will always be water somewhere around the protest. Bring your own though, because side note, there have been accounts where protesters have been given water that have been laced with antifreeze, so you're going to want to watch out for that. Don't just drink any random water that comes to you. But if your friend brought water, ask to borrow it. And to clean wounds, you're going to need a lot of water. And yeah, if that doesn't work, after you're done cleaning the wound, you're going to want to take a Q-tip, dip it in the solution, and just drag it in the wound while twisting to make sure that there's no dirt, no bacteria in there. Then you're going to want to take a gauze pad. Always have scissors with you in case there is clothing or something. These are clothing shears that I got also at a drugstore, pretty cheap, to cut through any clothing that may be preventing you from dealing with the wound. Get a gauze pad like this. This is a gauze compress. Dip it in the wound. You can cut it to the shape of the wound. So like this one's pretty small, cutting a small piece, folding it, dip it in a solution and put it on the wound, and then bandage it. Wounds, however, need to breathe. So unless it's a really major wound where you don't have enough, so unless it's a high-risk wound, if it's a lower mid-risk wound, I highly suggest investing in something called Tegaderm. Tegaderm is essentially medical grade saran wrap. It's a clear plastic film that allows the wound to breathe, which is very important. You don't want to like just compress everything in there, especially since you're putting something moist in there, even if it is an antiseptic and anti-infection agent, it will still kind of just cause a lot of just compression. It'll close off the environment and it'll be a warm, moist environment, which is ideal for bacteria growth, which you don't want. So Tegaderm is great because it is a breathable film and it will allow the wound to heal much faster and decrease the rate of infection. So clean around the wound, clean in the wound with the solution, put a antiseptic in the wound, cover with a bandage, and make sure you also go to the hospital after this. This is just the first round of cleaning. You're going to want to do this daily, maybe twice a day. This type of bandaging will be good for, I say, about a 24-hour period. Actually, let me just show you. So here I have a water bottle. This one's half empty because it's my drinking water, but anyways. A few drops. Swirl it around. Still too light. Add a few more. Swirl it around. Perfect consistency. This may actually be a bit darker than what you need, but for those purposes. Soak it up with a syringe. Squeeze it at an angle to really clean the wound. When you're done with that, wet the gauze, preferably in a better way than I just did. Bend the gauze, put it inside the wound. After, of course, you soak a Q-tip in the solution, go in the wound, and really just twist as you're dragging out. This will be done afterwards, so there won't be that much blood, more of just an open wound. Put the gauze compress on it, and then the Tegaderm. It looks like this. Place over the wound. Then you pull off the edges. I did not place it properly because I am doing it on myself, which is not always fun. But essentially, you have the skin-proof barrier with the disinfectant in the wound, and it should be fine if you disinfected it properly. Really take your time on disinfecting. It is extremely important if you don't want. Infections are horrible to deal with afterwards. But yeah, that's how you deal with a low-risk wound. For a wound like this, it would also be ideal to use something along the lines of sports wrap. I know this is a breathable Tegaderm material, but you still might want to wrap something around the edges for it, just to be safe, just to keep more stuff from causing injury. So now it's secure until you get the person out of the protest, out of the dangerous environment. Then they can remove it, and they're just fine with the Tegaderm. This just offers an extra layer of protection, just in case. And oh look, it matches skin color because these are made for white people. But anyways, for mid-risk wounds, it's going to be essentially the same thing, the same cleaning protocol, the same washing protocol, same as with the dislocations and the bone fractures. Check pulse underneath and above, clean everything, and that's essentially the same for mid-rank, low and mid-rank wounds. Higher rank wounds are going to be those that are very, very deep cuts, the type that you can see the fascia, that you may be able to see bone. Essentially clean it the same way, but don't worry, I wouldn't attempt using things like Tegaderm for it, using things like that. Really just fill it with gauze. Use the disinfectant, use a wet layer at the bottom, but then pat it with gauze on top, and then wrap that gauze with the sports bandage. This thing does not really stick to anything at all except itself. It's self-adhesive, so it won't be a nuisance, and it's strong, it's durable, it offers protection for the wound, and it'll keep everything in place until that person gets to a hospital, which is a high risk. Higher risk wounds also involve, that's the lower end of high risk wounds. Higher end high risk wounds are going to be things where people are bleeding profusely. Most likely an artery is going to be nicked. This is most likely to happen in the leg. It could also happen in the arm. You can tell it's major bleeding, like I said before, if there's a pool of blood this much. And for cases where there is major bleeding, you may want to use a tourniquet, which I will get to in a second. However, only use a tourniquet if there's literally if it's literally spraying blood and you cannot stop it just by applying pressure. For wounds, you want to apply a lot of pressure to stop the bleeding, and not indirect pressure unless it's a tourniquet. Just direct pressure on the wound with gauze, with the bandages. After cleaning it, just pressure to make it stop bleeding. If it's bleeding profusely, don't worry about disinfecting it, because likely the blood coming out will carry out anything bad, so you don't really need to worry about disinfecting it yourself. The hospital will do that. They will most likely need stitches, surgery. The hospital will worry about cleaning it. Hospital will I can't even speak today. The hospital will worry about disinfectant. You just apply pressure. If it's bleeding a lot, it's high risk. Apply pressure, do the bandages, forget about disinfecting for a minute. Bandages, pressure, sports tape, get them out of there. The sports tape really helps a lot. It puts pressure for you as tight as you want it to be. But be careful not to cut off circulation. Check circulation under. If it really is an arterial bleed, you may find it a bit harder to get a pulse. Before I talk about how to make a tourniquet, I want to talk about impaled objects and just basically things that are impaled in the wound. How long has that been? Anyways, just to talk about things that are impaled in the wound. If there's shrapnel in the wound, if there's a foreign object sticking out of the wound, leave it in there. Don't take it out. If there's some dirt and a little bit of rocks just on the surface that you can get out with water pressure or with a Q-tip, cool, fine, that's okay. But if there's something literally protruding in the body, do not pull it out. Leave it in there. You may cause more damage by pulling it out. There is a procedure on if you should pull it out or not, but that's just a waste of time for me to tell you. Don't even bother. If there's something in there, leave it in. How to treat a wound that has that, I will talk about that right now. Here's another visual demonstration. If there's something sticking out of the wound, yeah, I don't have a paste. This is just gel. If there's something sticking out of the wound, don't remove it. Under any circumstance, do not remove it. Same goes with bones. If there's, I know I told you to like track into position for minor just dislocations and bone fractures, but if the bone is sticking out of the skin, do not put that back in the body. If there's something sticking out, do not pull it out. What you want to do is clean around it. It's the same principle as before. You want to spray around the wound. I'm getting this everywhere. I hope it doesn't stain. Spray around the wound. And what you're going to do then is use gauze. Again, this is another instant where you're going to forget the Tegaderm. Use gauze. You can rip a bit in the middle of the gauze. Put that over, this is so hard to do on yourself. Put that over the object like this, and then continue. Put that over the object, and then continue to wrap around. It may continue bleeding, it may not. Just try not to disturb the object. Just wrap gauze around. I'm wasting so many medical materials for this video. Wrap the gauze around the injury. Make it tight. Keep it there. Be sure not to pull the thing out. Be sure not to move it, not to aggravate it. Make sure nothing is touching the object. I messed up because I'm doing this on myself. But yeah, just wrap gauze around it. Let it stick out. A lot of these injuries, you're going to end up putting it in a sling anyways. But gauze, bandage, disinfect. Leave the object in, for the love of God. You can cause so much more damage by pulling it out than you realize. There is so much fake blood all over the place. God, real blood should not stain this easily. Okay, so now some older first aid classes will tell you to put direct pressure, indirect pressure for any number of wounds. However, an arterial bleed or a bleed this bad is the only instance in which you should be using indirect pressure. So let's assume the artery is right here. I'm not going to use fake blood because literally to mimic this I would need about a gallon. It's right here. It's bleeding profusely. It won't stop. Ideally, like I said, 3 triangle bandages. I already used one because someone I knew needed a sling during the last protest I went to, and I haven't had a time to make another one, so I'm using this towel. What you want to do is tie the towel above it, and I mean directly above it. the magic. Okay, I've decided to use a scarf instead because the towel was way too thick and it was not tying properly. So you tie a knot with the scarf or whatever fabric you have. Make it tight. This is very hard to do it yourself. Above the wound, but like directly above the wound. Tie one knot. I'm going to take 2 triangle bandages, slide them under the knot you made on both sides of the knot, here on one side, here on the other, and then tighten the knot. At this point, you are going to use the stick and put it on the knot. Then you will tie another knot with the first bandage or the scarf over it. Actually, using this makes it much easier to color code. What you're going to do now is twist. So you're going to want to twist. Now normally you'd want to twist this about 5 or 6 times until the bleeding stops. At that point, so this will gradually tighten. You're normally supposed to use a triangle bandages or cut a piece of cloth. The scarf is still way too thick, so it's sort of like turning with it. I just cracked this. Anyways, so when you're at the desired position, take the bandages. There should be 2. 1, 2, because you slid 2 underneath, right? And tie a knot, locking the stick in place. Then on the other side, get this out of the way. This is why it's good to have scissors. You can cut the excess bandage away. Tie it on the other side. This will keep the stick from moving back too much, and it'll really just lock it in place. This is kind of poorly done because I'm doing it on myself. The scarf is really thick and I'm not gonna cut off my own circulation. But yeah, do this. And what is really important is you write with a Sharpie, I have Sharpie, the time that you made the tourniquet. Because if this tourniquet is done improperly, someone could lose an arm. If this tourniquet is left on for too long, then it needs to be taken off in a hospital setting. And by too long, I mean about 10 minutes, more than 10 minutes. If this tourniquet is still on, it needs to be removed in a hospital because everything in this arm is essentially more or less dead. And if you release the tourniquet outside of a hospital without doctors who know what they're doing, all that stuff will just flood back into the body and it can cause so many problems, heart attacks, stroke. You don't want that to happen. So write the time and get that person to an emergency room immediately. Like I said, tourniquet is not something you should do lightly. It's not something you should do for every major bleeding. It's just a last resort. If it's in between the person's arm and their life, that's when you do a tourniquet. Just to be clear, you're gonna want to turn it until the bleeding stops, and then when it does stop, do about a half or a quarter turn just to be sure. Check pulse afterwards. If the pulse is still there, that's good. But if it's not there, consider maybe loosening the tourniquet slightly. If it starts bleeding profusely again, then retighten it back to what it was. But if it's only bleeding a little bit, then essentially it's kind of a bit worth it. Alright, I just wanted to take this time to thank the 4 people watching this video. You know who you are if you're actually watching this. And I thought now would be the perfect time to talk about tear gas and pepper spray. So first of all, what is tear gas and what is pepper spray? Aside from the name, tear gas isn't actually a gas. It is a powder that is shot into the air. And because it is a powder, it can be hard to get off and it is attracted to moisture. I'll talk about how to combat this in the right tactics later on, but this is important to know for medical reasons too. The procedure for tear gas and pepper spray is generally the same, so I'll explain tear gas. Pepper spray now too. Pepper spray isn't exactly just water or a liquid spray, it's filled with oil too, which makes it extremely hard to get out. So water alone won't get it out, and milk won't either. So what you want to do for this is prepare I believe the ratio, you can check this online, 3-ounce baking soda for 8 ounces of water. Honestly, the ratio doesn't matter that much, and this makes a form of soap-like detergent. This is only to be used for skin. Tear gas and pepper spray make the skin feel like it's on fire. And this is to clean the skin, not the eyes. It could also clean the face, but this will really work to get rid of that oil. Follow this by a liquid antacid. This will do most of the cleaning. It'll get, because of the baking soda. Baking soda is basically detergent, and it'll get rid of the oil from the pepper spray. It'll get rid of the tear gas, and it will really clean it out. But the pain won't really subside that much. So to get rid of the pain, I suggest followed by liquid antacid or milk of magnesia. One of the three, the best solution is this, followed by a liquid antacid, and then milk of magnesia. Milk of magnesia also can help with sound cannons, which police are also using, but as I mentioned before, another great thing to do is get gel earplugs. I personally have this brand. They form to fit in your ear. You can get them anywhere. Even the pharmacy has a brand itself. This is filled with gas. So yeah, 3-ounce baking soda to 8-ounce water. It works for pepper spray, it works for tear gas to get rid of it off of skin. For the eyes, however, if you're really stuck, then follow the same procedure of this formula, liquid antacid, and then milk. The milk gets rid of the pain, but it doesn't get rid of the substance. It won't get rid of it because it's oil. The baking soda and the baking soda, because it's a detergent, sorry, words don't work, will get rid of the oil and will get rid of the powder. However, baking soda is also a crystalline substance, meaning that it could aggravate the cornea, it could scratch it up, and it's just not good to get it in your eyes. When you are going into the eyes, it's kind of hard to show, but you want to go from the corner of the eyes in, and then it'll drip off the bridge of the nose. If you're wearing contacts, take the contacts out immediately. So here at bridge of the nose, you should probably use an entire water bottle for one eye and then the same for the other eye. Water alone will not get it out. But yeah, if you're really stuck and you can't get anything else, this will work. But what I highly suggest is an eye wash. You can get a saline eye wash at any pharmacy, any drugstore. It's pretty cheap. I think it's like $3 to $5, and that'll rinse out your eyes. It's an eye rinse basically. That's pretty much it. It'll work much better, and it won't be corrosive for your eyes. It won't scratch up your corneas, and it will wash out whatever's in there. But if you don't have access to that, this followed by liquid antacid followed by milk. What the baking soda will do, like I said, it's a detergent, will wash it out. The liquid antacid will neutralize it, and the milk will neutralize it, and the milk will remove the pain. It'll act as sort of a numbing agent for your eyes. So now I'm going to talk about burns in general. There are a few different types of burns: 1st degree, 2nd degree, 3rd degree, 4th, and 5th. For the ones you kind of need to know are sort of surface burns, mid-surface burns, and like deep burns, depending on how deep they go through the layers of your tissue. The treatment is generally the same: a very cold compress, lots of cold water to cool it off. If it becomes to the point where it breaks the skin and there's boils that form and blisters that form, like past the point of blisters, then it's a higher degree burn, and you need to go to the emergency care unit, the burn unit, immediately. Go to the hospital. That is a high risk injury. But if it's just a minor burns and if there's a few blisters, cold compress, keep replacing the cold compress, and you want to wrap it in a way, you want to sort of protect it in a way that there won't be any friction. So normally instead of, you would use gauze, but for burns like this where there are blisters, you would need more of a clear, transparent, non-friction protection, which is where burn creams and ointments come in. What they do is they leave a protective film over the affected area, and that prevents any friction from affecting it, because friction on blisters is not a good idea. That's where things like blisters in general, moleskin applies. Make sure to pack some of that in case. A lot of people will be walking, so there might be some blisters. That's kind of minor first aid though, that most people won't really ask a medic for. But it's just good to know in case it happens. For burns, one thing I forgot to mention is something called gel dressings. It's what I was talking about when I was talking about like creams and ointments. It should be in the same section in the drugstore. They call it a gel dressing. There's a few different brands. Basically, it prevents friction. It covers the wound in like a gel substance, and it just keeps things from hardening. Now, sound injuries. I've heard that some police stations will start using sound cannons. I'll try to put a picture somewhere up here of what they look like. That's where earplugs really come in. Like I said, get the gel type. They really fit to the ear. They don't fall out when you're running. But milk of magnesia, I heard, helps with this. I don't really know how to treat it. Really just get out there as fast as possible. And as for water, if you guys are affected by tear gas and by pepper spray, and you manage to inhale some of it, even after the precautions that I'll mention later in the safety section, drink water, but be careful about which water you're choosing to drink. Like I said earlier, some protesters have reported that people have been putting liquid antifreeze in water bottles and giving them to protesters. Just careful where you get your water from. As for with any toxins and any substances like that, what you have to do is remove it from your body, remove it from the area, and dilute it as well as possible. Meaning if you inhaled it, exhale as much as possible and try to inhale cleaner. If it's on your skin, remove it from your skin as fast as possible and try to dilute as much as you can with water. Same as if you ingest it. So now on the topic of toxins, we're going to go into allergic reactions. There's a few types. I don't have time to go into how allergic reactions work, how they occur, the anatomical responses your body goes through. However, I will talk about the different types of allergic reactions. I believe there are 4. The first one is a local reaction. Normally, most common is something like a bee sting. What you have to do in that instance is remove whatever's causing the bee sting, remove the toxin, like the stinger, and dilute it with water or some diluted water or saline solution. That's pretty basic. Next is a mild allergic reaction. For a mild allergic reaction, it's kind of just general symptoms, hives, itching, that's pretty much it. There's not that much face swelling. Your level of consciousness is still there. You're still awake, active, everything is normal. And you can generally treat this with allergy medications such as a antihistamine, or from a mild allergic reaction to anaphylaxis. There's kind of this middle stage. Basically, if someone has a mild allergic reaction and they're a bit itchy, they have a bit of hives, monitor them, because if that goes into anaphylaxis, then that's a big problem. Anaphylaxis is essentially the same, except your throat is getting itchy, it's getting swollen, your face is swelling up, your level of consciousness is going down. You need to get an EpiPen. You need to get epinephrine into that person immediately. Epinephrine is a intramuscular substance, which means it needs to be injected in the thigh. There are a lot of first aid classes teach you how to use EpiPens if you take standard first aid. If not, there are instructions on the side of the pen. But basically, you have to remove the cap, remove the safety, and just stab it into the leg. Basically, stab it into the large muscle. This is one of the muscle on the leg. I'm sure I can't really see here on the side. Chances are, if the person is having an allergic reaction, they have an EpiPen and they know what to do. If not, and it's the first time they're experiencing an allergic reaction, which can happen if large amounts of people are getting tear gas and pepper spray, there can be an allergic reaction there that can lead to anaphylaxis, and they don't have an EpiPen. You need to get that person to the emergency room right away. During anaphylaxis, one of the major critical systems is being endangered, the respiratory system. It is closing. That is a primary system, and that needs to be taken care of immediately. If you don't have an EpiPen, call out to see if anyone has. If you're working with a group of medics, chances are one of them might have. If you live in Canada, it is legal for you to buy epinephrine over the counter without a prescription. There is no recreational use for epinephrine, so I don't see why some places limit it. However, in the States, I understand that it's not really an option, because EpiPens are like, what, Depending on where you live, $100 to about $300 minimum. I've seen them cost so much more. But chances are, if you're with a group of medics, at least one of them has it. If not, call out in the crowd to see if anyone is willing to spare an EpiPen. That's about it. Don't be afraid if the EpiPen is expired. I'm not encouraging the use of any type of this. Technically, this entire video is for academic purposes only. However, EpiPens are generally good for about 5 months to a year after their expire, especially if you, I believe, freeze them. Don't take my word for it. Beforehand or while you have them. So don't be afraid, just use whatever you have. It's better than nothing. So now we're going to talk, speaking about respiratory issues, now we're going to talk about asthma. A lot of people have asthma, and in this time in a pandemic, especially with all these tear gases going around, you have to know how to treat asthma. Basically what happens is with asthma is your bronchioles are constricting. There's a few other things that are happening, but let's just focus on that. And when someone is having an asthma attack, you need to get them the rescue inhaler. This is different from the regular inhaler. There should be two types. One type is the regular asthma inhaler, and the other type is something called a rescue inhaler. Normally you can differentiate by the tips, but this kind of changes province to province and state to state, so kind of look into it yourself. Generally, the normal inhaler will have an orange tip, and the rescue inhaler will have a blue tip. So in the rescue inhaler, there's a chemical, I believe it's called salbutamol, and it's a bronchodilator. That'll just open up the bronchioles. If someone is having a really bad asthma attack, that means they're so constricting that they cannot breathe and they're suffocating. Epinephrine is also something you can give to them if they have an asthma attack so bad that they fall unconscious and they stop breathing. If they stop breathing because of an asthma attack or an allergic reaction, give them an EpiPen. Another thing to mention is problems with sugar. So if someone has a hypoglycemia, so that means they have their body has a sugar deficiency, something along those lines. I'm not going to get too technical because that would involve a lot of explanations, and I don't really want to bore you guys with that. But basically, if someone is hypoglycemic and their energy levels are going down, their level of consciousness is going down, they're feeling a bit loopy, and they may even pass out from this, give them sugar. If someone is hyperglycemic, the opposite is true. You need to give them insulin, their insulin. Normally, this shouldn't be too hard to figure out on the spot. I will include a link down below about how to do this. But if the person is feeling a bit low energy, their level of consciousness is going down, and you know for a fact that they're hyperglycemic, tell them, hey, have you taken your insulin today? Hey, have you checked your sugar today? And they will generally take it from you. Okay, so I already talked a bit about soap notes, but I'm going to talk more about cataloging injuries because this is very important. You have to catalog everything. Name, age, birthday, weight, emergency contact. Since these are protests and you want to maintain anonymity, emergency contact could also be a lawyer, a local group that advocates for the protesters, or even your family medicine doctor. Your phone number, or the patient's phone number, yours included, doesn't matter. Actually, no, don't give out your phone number to the protest, could cause issues. But their phone number, in case something happens to them, or they lose their phone or anything. What happened at the scene, what led to the injury, mechanism of injury, how they were when you found them. Their symptoms, allergies, medications, not only medications that they're on, but medications that you gave them and when. Pertinent history, what happened to them, is everything alright, like, do they have a history of being asthmatic, did they recently have surgery, did they have a concussion a week ago, things like that. Last ins and outs, the last foods they had, the last time they went to the bathroom, the last time they drank water. Events, what happened to leave them in that condition? Were they shot at? Were they tear gassed? Did they fall down? Were they hit by another protester? Physical exam, I mentioned the wet check before. Write down the results here. Write down any injuries they may have. There's even a diagram, you write it here. And also measure their vital signs, the time, the pulse, respiration, BP. Blood pressure, don't worry too much about blood pressure. I'm not going to teach you how to take blood pressure. It's just, honestly, in this setting, it'll take more time than it's worth. At the back, list of problems, anticipated problems, and a treatment plan. So a problem might be major blood loss. Anticipated problem lower blood pressure, that the treatment plans stop the blood loss. It also might be good if they know their blood type to write down their blood type. And if you don't have a chance to get this book, I'll post a PDF where you can download this and save it, and it's a lot easier. But if you don't have access to that either, write it down on a piece of paper, and if you don't have access to a photocopier, then just write it on the patient's arm. You can grab a Sharpie, go to the protest, write it all on their arm. Their name, their age, date of birth, allergies, medication, everything I just listed. Write it on their arm. Write it down on a piece of paper to help you remember. And when you're with the patient, write it on their arm. And you could even take hairspray and hairspray it on their arm, assuming there's no injuries there. And it'll make it last longer. This will really help the doctor or the next level of care provider, EMT, who will take the patient from you in case there's something that happens. It'll save them a lot of time, and it's really, really important. Now I'm going to talk more about the psychological aspect of it. There's 3 parts I want to talk about: your mental health, the patient's mental health, and then debriefing. Firstly, your mental health. You need to go in this expecting the worst. Expect just the worst possible situation in every situation. Make yourself mentally prepared for what you're about to go into. This is not a calm environment. This is a hostile environment. And not only is it a hostile environment, but it's a hostile environment that your brain never associated to be hostile. You are getting attacked by people that you were raised your entire life told that they were there to protect you. Now you're being attacked by them. That's gonna have a certain amount of psychological damage. Watching people, your friends, get attacked for no reason other than performing what they were told their entire lives is their right. That's gonna have psychological damage, and you need to be prepared for that. Not only that, but afterwards, you need to talk about it. You may need to reach out to a therapist. You may need to talk to other medics. Just talk about it, work through your issues. There are many tips I can give you for psychological tips, and I'll try to find an article to put in the description. There's going to be a lot in this description, but that's very important. The patient is in the same situation. They just got injured by people that are supposed to be there to protect them while they were exercising their peaceful right to protest, standing in streets that they paid for. This is a horrible situation. The fact that I even have to make this video talking about how you can save the lives of people that are getting shot at by cops is horrible. But it is a lot, and it is your job as a medic, as a first responder, to calm your patient down. If they're having a panic attack, ground them as best as possible. Name things that they tell them. What can you hear? What can you see? What can you taste? Have them breathe. Have them feel something. Take a stress ball with you and have them just feel around with it. Maybe it'll calm them down, maybe it won't. But it's your job to figure out ways to calm down your patient. And if you're freaking out, it's your job to calm yourself down and to calm your fellow medics down. Because you cannot treat a patient if you yourself are unhealthy. If a person is hyperventilating, breathe with them. Coach their breathing. Tell them to breathe slower. Tell them to synchronize their breathing with you. You synchronize your breathing with them and slow them down. Get them to calm down as best as possible. Lastly, I want to talk about debrief. Debrief is something that should definitely happen after a protest. You and your buddy, like I said, you go to the protest with somebody. Even you with your entire medic team, or even just record it on your phone by yourself. Record your conversation with your buddy too. Debrief. Just say everything that happened at the protest. You won't remember it the next day, you won't remember it as clearly. Say everything that's on your mind. This will not only help you put debriefing or something, or called debriefing, also called the retrospective. Retrospective is good because you get to go have a long discussion, say what went well, why it went well, look back on your successes, and also look at what went wrong and and also look at what went wrong and why it went wrong, and look at ways you can improve in the future. Another important thing to know about the psychological care: if someone is having a panic attack or stress attack, or they're psychologically unwell because of a source of trauma, get them out of that area of trauma. And if you can't, then do what you can to calm them down. Last thing I want to talk about before we move on to the safety tactics, riot tactics, and riot gear is handcuff injuries. So a lot of people can get handcuff injuries, and those are nerve injuries. They're not going to heal easily, and they can be very traumatic to some people because they remind them of the trauma they just endured. It can be very hard, and a lot of it is psychological. There's honestly not much you can do in terms of treatment other than just time. Lastly, more legal issues. This isn't necessarily medical legal, more protest legal. I'm not going to talk about it here because it has nothing to do with being a medic, but more being a medic in these situations. However, in several links down below, there'll be two street medic guides and one riot medicine textbook. They will all talk about what to do afterwards, what to do if you're arrested, legal implications of doing all this stuff. It'll all be well detailed and it'll be down below. Alright, take two since the first one was deleted because technology. Anyways, so DIY riot gear, fun, right? So we're gonna go head to toe. For helmets, there's honestly, you can't really do much with a helmet. You can't make a helmet. Well, you can, but not an effective one. I suggest a construction helmet, a ski or snowboarding helmet. If you have to, use a bike helmet. And if you don't even have that, wear layers, wear several hats, a hoodie, whatever you can to protect your head. People are shooting rubber bullets, there are cans of tear gas going off. You need some type of head protection. Then for face, I'm going to put a picture up here or somewhere around if I get the editing to work properly. And this is basically kind of what mine looks like. I didn't have foam, so I used medical tape. It's pretty standard. There's the two strings I used from the disposable mask. This disposable mask because they are everywhere. This is plastic that I attached to the top to just give an extra layer, an extra seal. This is supposed to be like a riot tear gas mask. Will this keep out tear gas? I'm not sure. Will it help? Yes. Will it keep out pepper spray? Yes. It's really cheap, really easy to make. However, since we are in a global pandemic, buying an actual face shield isn't that hard to do. I got this for $12 at a hardware store, and it's pretty standard. That's just about it. Then there are face masks. Regular face masks like these will not stop tear gas. Tear gas isn't a gas like I said before. It is a fine particle, which means most construction masks and most mechanic masks will filter it out. So will any 5-layer mask with a carbon filter. This is a carbon filter that I got from a reusable mask at a drugstore, and since it's 5 layers, since it's carbon filter, this will stop tear gas. As simple as that. You can get a carbon filter pretty much anywhere. You can get these masks, you can make them pretty much with materials from any hardware store. It isn't that complicated, but don't think that your regular mask or even your designer masks will stop the tear gas, because it won't. You need this, and there's a difference between the disposable masks we use here and the actual medical grade masks that stop these types of things. These masks are more elastic based and they're like a fabric, whereas the other ones are a cone shape that kind of goes over and creates a seal, well, a better seal to keep the particles out. You're going to want to get the better ones that have a seal if you can, and if you can't, then make one of those ones with carbon filter, several layers of it. Sorry, there's something in my eye. And that will keep out. Next, body protection, body armor, sorry. This I made myself as well. What you need is a steel plate in the middle. I got the steel plate from a baking sheet I got at the dollar store. You can cut it out with pliers, literally just a baking sheet, cut out the middle part. It's a steel plate. Wrap it in 2 rolls of duct tape, and I don't mean like regular rolls you get at the dollar store. I mean like industrial actual rolls of duct tape that are like 2 inches thick all around. Be generous with the duct tape. Put a few layers of fabric in between a few of the layers of duct tape, like cotton or old t-shirts or fabric you've laying around or an old hand towel. It'll increase the protectiveness. And then when you're finally done, like about 90% of the duct tape, add a back to it that acts as a impact absorbing plate. I cut out part of this foam kickboard, also got at the dollar store, and put it here. It's very flexible. This will not stop a bullet. Let me be clear. It will not stop a bullet. It may stop. It will definitely stop things like if someone is shooting salt rocks, which I heard someone was also shooting a bow and arrow. This may stop that. It'll definitely slow it down enough so that it won't kill you. Same with knives. It'll definitely slow down the knife enough so it won't kill you. But this was really designed to be used against rubber bullets. This will absorb, I estimate, about 90% of the impact from a rubber bullet. This was made with the design of rubber bullets in mind. Don't try to use this against actual guns. It will not work. If you want to make something of a higher grade protection, look into buying Kevlar if you want to make it. No, I picked this design because it is extremely soft, lightweight, easy to make, and cheap. If you want a sturdy, more bullet resistant, knife resistant body armor, then I suggest making hard body armor. There is a video on YouTube about how to make one out of fiberglass for about 30 bucks. That's good, but then again, that's a hard body armor. I chose this one because of its level of flexibility, just more comfort. That's why. But yeah, just get something that'll prevent rubber bullets from hurting that much. You can also just use, if you don't mind, something that's hard rather than something that's flexible like this. Then honestly, you could also use a wooden cutting board if you find one that's big enough to block your chest, and just, I guess, tape it to your body. What's next is forearms, elbows, shoulders, just all types of padding. For your forearms and your hands, I definitely suggest gloves. Get good gloves. For me, I'll be using these ones. These are not medical gloves. These are basically like, I guess, dishwashing gloves. I got them in a pack of like 50 from the dollar store for $4. Pretty good. They're very thick, so they're pretty heat resistant. For your forearms, if you look up Kevlar sleeves or like heat resistant / resistant sleeves on Amazon, you can find two for about 20-30 bucks. They're / resistant, heat resistant, lightweight sleeves that you can wear, and they can be very useful in these protests. For things like elbow pads, shin guards, things like that, any sports appliance store, much cheaper than if you want to buy riot gear. And they work almost just as well, especially in this case when you don't have to worry about bullets yet. They work just as well. Another thing to keep in mind is clothing. You want to wear layers and you want to cover all your skin imaginable. Tear gas isn't just called tear gas because it affects the eyes. Any part of the skin that it touches will burn like crazy. So you want to cover everything. Head to toe, long sleeve, I don't care what season it is, cover yourself completely. And if you do not have to wear glasses, I highly suggest getting like swimming goggles, also available at the dollar store. I don't care if you look stupid, wear goggles, it'll help a lot, especially if you don't have a face shield. If you don't have a face shield, goggles will be your best friend, although I highly suggest, honestly, both, if you want to be really cautious. And what else is there? Oh yeah, umbrellas. You saw what the Hong Kong rioters did with umbrellas. They're great against tear gas, great against the pepper spray. That's pretty much all I can say about that. And your socks. Keep a bobby pin in your sock. They can be very, very useful for getting out of the zip tie handcuffs and even regular handcuffs. I unfortunately do not have anything to give you a demonstration. However, I'll try to put a picture up. If you open the bobby pin and you put the tip through the part of the zip tie that has a little notch and you bend it backwards, it'll release the lock on the zip tie and you can slide out of it. And for handcuffs, if you stick it in, you stick it in the bottom side and you basically just twirl it around the lock. It'll mimic a key and it'll open the handcuffs too. For handcuffs, you can also use the chain, wrap the chain around itself, and the chain will basically, until the chain, like wrap it around and just pull it slightly until the chain locks on itself, and then the chain will lock on itself and you can use that pressure to kind of just snap it. It's harder than it seems and uses a lot of force, but if you're just trying to pull it like this, it's almost impossible. But if you use the chain against itself, it is a lot more effective. Okay, now for dismantling tear gas, there's two things that I heard work. One thing is water. Tear gas is activated by heat, and if you put enough water over it, getting rid of that heat, it will basically dismantle the tear gas. That's kind of the cone method the Hong Kong protesters used. They put a cone over the tear gas, dumped bottles of water. In real life, it will take a lot more water to put out tear gas, and you have to worry about dozens of canisters of tear gas getting fired. However, it's good to keep this in mind. Another thing that I heard works is, since tear gas is attracted to moisture, you can make an aerosol grenade. Basically, just buy an aerosol grenade or make one out of like, deodorant. Also from the dollar store. I would never use this on myself. But spray deodorant. It is moisture, it is wet, and it is an aerosol, and tear gas clings to aerosol particles. If you just stab this, or you put a pin in here, tie tape around it, and pull the pin and throw, you can make a makeshift aerosol grenade, and that aerosol will really drag down a lot of the tear gas particles to the ground a lot faster than normally. Will it help Monument? Will it make a big difference? I honestly can't tell you, but it doesn't hurt to know this information. And that's pretty much all I can tell you. There's so much more I wish I could teach you about first aid, but like I said at the beginning of the video, I have over 100 hours of formal training. I cannot possibly teach you everything. I will put a dozen resources in the description down below. Please check them all out if you're interested. And again, this is all for academic purposes only. I do not want to see you guys using these in the streets. Academic purposes. I do not claim any responsibility for any of this information that is being shared. It is very much for academic purposes only. I'm just gonna leave it at that. Thanks for watching.